So what is going to happen during your C&P examination for your back condition? The C&P examiner is going to be answering three questions. Do you have a current chronic medical diagnosis of a back condition? Number one. Is that condition linked to your active duty service? If you're not already rated and your examination is for a new claim for a back condition, the C&P examiner will have to answer that question in the form of a medical opinion. Does it medically make sense that this veteran's current condition is linked to their active duty service? The final question is, how bad is your back condition? How severe are your symptoms? So let's talk about the current formal diagnosis. If you're treated at the VA Medical Center and you've been diagnosed, the examiner will have access to that. If you're treated privately, hopefully you've already provided that evidence of that diagnosis and treatment. If you haven't, be sure to bring it with you to show the examiner so they can determine that you have a current condition, a chronic condition of your back. If you're not service connected, the C&P examiner will be asking, did you have symptoms on active duty? They will have your active duty records to see, to review. If you had treatment and a diagnosis on active duty, the C&P examiner is going to want to know if those symptoms continued until your current situation, your current condition. Did you have continuity of symptoms? So they'll be asking you about your symptoms over time. If you don't have medical treatment during a long period of time after getting out of service to your current diagnosis, the C&P examiner is going to want to see evidence that you continued to have symptoms during that time. Now, the other thing the examiner is going to want to determine is if you were diagnosed with a lumbar strain on active duty and now you have arthritis of your back, the C&P examiner has to determine if your strain on active duty continued and was severe enough to eventually lead to arthritis now. So if you have a diagnosis of chronic back strain in service and you have a current diagnosis of low back strain, that's easier for the examiner to determine that they're one and the same if you've had continuous symptoms. A little harder for the examiner if you have a new diagnosis of a condition that wasn't diagnosed on active duty. But they'll be trying to determine if medically it makes sense. Does the medical evidence support that your current condition is related to your active duty service? Finally, is your condition secondary? Like if you're not claiming a direct, if you're claiming a secondary condition, I have a chronic back condition secondary to my service-connected knee condition, the C&P examiner will have to determine, could your chronic knee condition that you're service-connected for lead to your current chronic back condition? So they'll want to have evidence that it developed after your chronic knee condition, that you had an altered gait or something was altered in your back because of your knee condition that led to your current chronic back condition. Finally, what are your symptoms and how are they rated? Do you have painful motion? Just painful motion with full range of motion is 10%. Do you have decreased range of motion? If you can only bend over 60 degrees or less, or more, sorry, if you can bend over 60 degrees but no more, that would be 20% back. If you can only bend over 30 degrees and not further than that, 30 degrees isn't very far, that would be a 40% back. Remember that you should stop bending when you have significant pain because you're not going to bend further than that in normal life if you have pain and discomfort. So your range of motion should be measured based on when you have pain, when the normal amount that you would bend considering your pain. Finally, they will measure rotation, side to side, as well as forward flexion. And some veterans will get a rating based on the sum of all of those movements. So that's how your C&P examination will go for your back. That's some of the things the C&P examiner will be measuring about your back and ask what kind of questions they're going to be asking about your condition. And it generally takes about 20-30 minutes. Thanks for watching.
Thank you for watching our video. Stay up to date by subscribing to our YouTube channel and following Trajector Medical on social media. To see if medical evidence could support the VA disability benefits for which you're medically, legally and ethically qualified, get started at trajectormedical.com.